Aloha mai kako. My name is Lisa Leilani Ka'anoi, and I'm the engagement specialist for our new department name, Mauliola Ma Lama Lama, which includes the Native Hawaiian Health Scholarship Program. And mahalo for joining us today, and mahalo to those who will be joining us via the recording. If this is your first time, we'll just go over some housekeeping. So this will be recorded and shared for everyone that registered. And in the future, if you would like to join one of our webinars and are unable to, then as long as you register, you will still receive the recording, and it usually comes out about a week after the presentation. You can also use the Q&A or chat feature for any questions or comments. Today we're going to be informal, so or you can raise your hand. We're going to be informal, and you can ask your questions as we go along. You don't have to wait until the end of the presentation. So we'll have one of our assistants keep an eye out on the chat box and the Q&A box. If you're new to our webinars, just for future reference, you will be automatically added to our email group to see what other webinars we have coming up in the future. And then at the end, there's going to be a link that pops up where you can share your mana'o, and this is where we get ideas for future topics. So it is on a Friday today, so if you have to run after this and you don't have time to fill out the survey, we'll go ahead and follow up on Monday with an email to see if you have any mana'o then. So let's see what else, if there is anything. Next, I will go ahead and introduce our guest speaker. Let's see here. So Charla Leialiʻi Naone is a Native Hawaiian registered nurse in the specialty of nephrology. She is a two-time awardee of the Native Hawaiian Health Scholarship. She is from Naone, Oahu, and currently the facility administrator of U.S. Renal Care, Dialysis, and Hawaiian. Welcome, Leialiʻi. I'll turn it over to you.
Aloha, aloha mai kako. My name is Charla Leialiʻi Puanani Rego Naone. I am, like Ka'anoi said, like Lisa said, I am from Naone, Oahu. My parents are Charles and Leialiʻi Naone. I'm a registered nurse. I practice in the specialty of dialysis and nephrology. And I am currently the facility administrator of U.S. Renal Care in Hawaiian. But first and foremost, I'm a proud Native Hawaiian mother of 3 beautiful girls. I'm a little bit nervous. It's been a while since I've done something like this, but I'm super excited. I'm blessed and honored to be here today. And mahalo to Mauliola Malama Lama and the Native Hawaiian Healthcare Scholarship Program and Papa'ololokahi for making something like this possible. I hope that the information I share with you will be useful and most of all inspiring to some of you. There's a lot of information to share, so I did prepare some slides here. And then we'll just go along. If you have any questions, just put it in the chat box and I'll try to answer them the best I can. Okay. So this presentation will be about dialysis. What is dialysis and a Native Hawaiian perspective on saving lives, because that's what we do. If you hear some alarms in the background, I'm actually in my clinic, and right next to me on the other side of the wall are our patients. So you might hear some ringing, and so please excuse that. Oh, excuse me. Sorry, trying to get this thing to. Okay, here we go. Okay, so some of the objectives. So I had to make a list. I'm very excited about this, and I could probably go on and on about certain parts of it, but I wanted to make sure that I review a little bit of everything. But my main goal today is to create awareness about dialysis and to try to alleviate some of the fear related to it. I'll review some statistics on Native Hawaiian health, and then we'll review concepts of renal disease, kidney function and anatomy, and then we'll go into the disease process. So kidney disease, and then what will eventually take some of us into dialysis. I'll touch on prevention and preparation, how you can support your ohana that is on dialysis, and then talk a little bit about the importance of having Native Hawaiians in the profession. So first, I just wanted to start with just a pause for some of us to think about dialysis, and what do you think about when you hear the word dialysis? Do you think about a family member? Do you think about a friend or a coworker, maybe an acquaintance? Do you live nearby a clinic? Have you ever seen inside a dialysis clinic? And also, what are your feelings and thoughts when you hear the word dialysis? A lot of the feelings and thoughts that I have felt myself was fear, and not a lot of positive. It's associated with a lot more negative feelings. And that's my own personal feeling and the feelings of my patients through the years. My connection to dialysis is very personal. So these three are only three. I'm related to more and connected to more than these three, but these three people pictured here are very important to me. On the left, you see with the leipo'o is my Auntie Kalau. She's my first experience in my lifetime with someone who was on dialysis. And the only thing I remembered about her being on and associated with dialysis is her being tired or not feeling well. And when she finally passed, I thought she passed from dialysis. That was my outlook. And I was probably in high school till my early 20s. And then my Uncle Julian in the middle, he suffered from diabetes. He was a very big man, loved to eat, like many of us. And eventually, he had he had diabetes and amputations of certain parts of his body. Then he went blind, and then he went on dialysis, which is usually the progression that we see. And then my Auntie Deb on the right, she had juvenile diabetes, and she held off for very long. She did pretty well, but towards the end, she was on dialysis for some time, and she chose to stop dialysis. So some of the Native Hawaiian health risks. So you hear the term Native Hawaiian health disparities. Native Hawaiians are at increased risks overall for different health ailments like obesity, heart disease, high blood pressure, and diabetes. So yes, we're definitely at more risk than our non-Hawaiian counterparts. And when it comes to dialysis, the highest risk factors for CKD is diabetes and high blood pressure. So these are facts that I've known for quite a while. You can pull up any report or any statistic report about it that will show you these facts. But I pulled up a few this morning, and one that I read said Native Hawaiians have the highest rates of chronic health disease compared to our counterparts. Our kane suffer from the greatest burden of chronic heart disease, obesity, and high blood pressure. Our wahine suffer at higher rates of diabetes, and all of these things can lead to chronic kidney disease and eventually to dialysis. So this is just going to be a basic overview of what the kidneys are, because a lot of times when I have patients that are new to dialysis and they had no clue they were headed towards dialysis, they have no idea where their kidneys are. So we have two amazing kidneys. And in each kidney you see here, there are millions of these tiny machines, and they're called nephrons. So these are the machines that make your urine. So they make shishi, and then it goes into your bladder. And then when you go bathroom, you know, you relieve yourself of all these toxins. The kidneys regulate your electrolytes. So you're talking about your sodium levels, potassium levels, calcium. Your kidneys know exactly how much to keep in your body and how much to express out of your body. So the kidneys will control fluid. So however much water you drink, or Simon, or you know, your afternoon pauhana drinks that come into your body, it knows exactly how much to let go of and how much to keep in your body. They're amazing, amazing organs. The kidneys, what a lot of people don't know is that your kidneys control, or are the messenger system that controls blood production. So your kidneys are the organs that tell your body to make more blood when you need more blood, and then to stop making blood when you don't need to make as much. And then it has a lot to do with bone management and keeping your bones strong and regulating calcium production. Two interesting facts about the kidneys is that you only need one to live. That's why you see a lot of people being a living kidney donor. So if you're healthy and if you pass the screenings necessary, you can definitely donate a kidney to a loved one, and then live the rest of your life healthy on just one kidney. One thing that I learned when I was in nursing school was that when you get a transplanted kidney, you'll actually have 3 kidneys in your body. Okay, so chronic kidney disease. I don't really like that last word because it's like disease, you know, it just sounds so negative. But the short term for that is CKD. But let me review acute kidney injury. So that acute kidney injury is temporary. So whether you have trauma or you have your kidneys become stunned from medication, that will stop kidney function for a little while. And then for the most part, it can be reversed. Now, when we have chronic kidney disease, this for the most part is irreversible. And I'm going to run through some of the stages. But how would you know when you're affected? Well, for the most part, you won't feel well. You feel tired. There's some fluid building up in the body. You get swollen. Your legs are swollen. You have a hard time breathing. Some people have itchy skin with a distinct scent, and then they have nausea and vomiting. But if you think about it, that can be associated with a lot of other illnesses. So a lot of people don't know that their kidneys are damaged. There are lab tests that can show if you have a kidney problem. So when you go to the doctor, sometimes people are in the ER for something else. You can go in for a knee surgery or a heart test, and then they draw your labs. And when we see your labs, we'll know immediately that there's a kidney issue, because we'll see some high potassium. You'll see a high concentration of toxins in the body. So that would be a lab test called your BUN or your creatinine, and then a decreased and low GFR. So for GFR, if you take anything home today, that would be the one thing I would want you to remember, is the term GFR. So GFR is your glomerular filtration rate. So this is the rate that your body is removing toxins. And there's a lab test for this that will show if your kidneys are being damaged. Okay. So the stages of CKD. So like I said, let's remember the GFR. So stage 1 is your normal GFR. So the number that you want to remember is you always want your number to be over 90. And then usually when you're reaching to stage 2, a lot of people don't even know. And quite honestly, some doctors don't, it's not something we really look at. But GFR stage 2 is mild kidney disease, is your GFR between 60 and 89. Stage 3 is a very critical stage. That's when we have our GFR between 45 and 59. So this stage, excuse me, I'm gonna go back. This stage is often the stage where the doctor might tell you, oh, you know, you have something going on with your kidney. A lot of people don't even know their number. When they start talking about dialysis, you know, some people are kind of, they're stunned to know, oh, something's wrong in my kidney. And then they give you this plan, a diet plan, diet, exercise, what you need to do to decrease the chance of you going on dialysis. But when they hear about dialysis, a lot of people don't want to even go back to the doctor anymore because they don't want to know. A lot of people end up passing away because their kidney function decreases so rapidly that they get sick. And then by the time they go to the doctor, it's too late. But if you follow your doctor's plan, which is usually a plan of limited protein and medication regimen, you can stall the decrease. So it can stay at stage 3 forever and you don't ever have to go on dialysis. Stage 4 is when your GFR is down to 15 to 29. And this is when they will ask you to place a vascular access in your body. I'll review that in a little while, but that's because in preparation for dialysis, we will need access to your blood so we can get your blood clean. Stage 5 is when your GFR is less than 15. A lot of doctors initiate dialysis when your GFR is at around 20. The name for this stage is end-stage renal disease. It pretty much means that your life cannot be sustained without kidney function and that you need dialysis. So what does dialysis do? I like to say that dialysis saves lives, that my nurses and my staff here at our clinic and all over the state, that we can genuinely say that we save lives every single day. Dialysis is a life-sustaining treatment and you need it to stay alive. There are 2 types of dialysis. We have hemodialysis, which is a type of dialysis I do here at my clinic. And then we have peritoneal dialysis and home hemodialysis. We do have a home therapy training center in my clinic, and this is where we train patients to do their own dialysis at home. So traditionally, dialysis used to only be given in center, but now straight from the hospital, you're able to do training, get training set up, and then do your dialysis at home. We definitely assist all of our patients and encourage all patients with end-stage renal disease to seek transplant, and we can help you with that here. The decision not to treat. So this is a real choice, and unfortunately, when it comes to Native Hawaiians, this is a choice that a lot of us choose to take. They have a fear. We have a fear of dialysis and don't know much about it, and decide that it's not for us, and eventually we pass away. So this is why I'm doing this, and this is what I hope to prevent. Okay, so what does dialysis do? So it pretty much replaces your own kidney function. Now, there's no way that the dialysis we provide here can replace, what your kidneys do. But in a nutshell, the dialysis replaces your kidney function. It removes toxins. regulates electrolytes and some minerals. It removes the excess fluid. And then we add in some medication to help with the hormonal side of your kidney function. So we give medications for blood production, iron levels, and bone management. So what's needed? Like what are the parts of dialysis? So one, we need access to your blood because that's what we're going to be cleaning out. So there's 3 different types of vascular access. We have our arteriovenous fistula, which I call AVF, arteriovenous graft, or AVG. And then sometimes if we don't get those placed into your arm ahead of time, we need to put in a central venous catheter. You have your dialysis machine. So when I used to work in acute dialysis, where I would start a lot of patients, brand new patients. Some knew they were going to do dialysis, some didn't know. But they would look at the machine and say, oh, wow, that's a big machine. What does it do? Basically, it takes clean water and some electrolytes and a buffer, meaning something to regulate the type of solution so that it can come into contact with your blood and it cleans your blood. So a dialyzer, which is here, I actually have one here. So this right here is a dialyzer. This is where the magic happens. So you have a cleaning solution that comes in to the dialyzer, and then your blood also comes down into the dialyzer. And then this is where the fluids are removed, the toxins are removed. And this is an amazing, amazing thing to have. Okay, so your vascular access. So arteriovenous just means that the doctor goes in and he joins your artery and your vein together. And then that's where it will build up to a place where we can place 2 needles into your arm. Some people don't have good access to their artery and vein. So the doctor will put in a graft. It's like a tube. He connects it and loops it. And this is where we will place 2 needles. One needle is to pull your blood out and go through the machine to get clean. And then the other needle is where the clean blood goes back in. Now, the important part I will want you to remember about this is that during stage 3 kidney disease, this is where the doctor might start mentioning if it decreases into stage 2, we want you to get this vascular access ahead of time. Now, it's critical that you get the access placed because a lot of people don't. And then when they end up needing dialysis, they have to put in this one. So it's a central venous catheter. So this one will put you at high risk of infection, but we still need to put it in to get access to your blood. So the left photo you see here, the tube is actually sitting in your heart. So they make a tiny hole, they string the tube down into your vein and right into your heart. And then you'll see the red and the blue port is what we'll use to connect to our dialysis line. The red port is your artery, arterial section. The blue is your venous. So the arterial side is where the blood comes out, goes through the machine, and then the blue side is where it goes back. People with the catheter, when they come into my clinic, we try to remove it right away. So if they come in with a catheter, I will help them make appointment with the vascular surgeon to get one of the, either an AVF or AVG placed so we can get that catheter out, because catheters put people at risk for infection. Have you ever seen inside a dialysis center? Most people haven't. This is our clinic out here at Waianae Mall. I don't think it's as scary as a lot of people might think it is. What do you guys think? In our clinic, it differs. The very first clinic I worked at was on Molokaʻi. We had 6 chairs at the time I was there. So 6 stations. We provided dialysis for 6 patients at a time. And here we have 25 stations. And I'll go into more detail about how we run the clinic. Okay, so preparing for dialysis. I always say prepare for the worst and hope for the best. Most people, like I mentioned earlier, most people who have decreased kidney function don't really know they have decreased kidney function until they're at about stage 3. Because that's when the numbers on your lab results kind of start to pop up. And the doctor will start mentioning it to you and trying to create a plan. Oh, my number here is incorrect. So stage 2, let's go back here. Let's remember, oh, I'm sorry. Sorry about this. So you go from stage 3 to stage 4. So stage 4 is actually a decrease. So that is anywhere between 20 and 40, around there. And so that's when the doctor is going to ask you to get your vascular access placed. We want you to find a nephrologist to start following you. So your nephrologist is your kidney doctor. And stage 3, we start to create the plan. And then stage 4, we start to implement that plan. And this, it really truly is a critical stage, because you don't want denial to get the best of you. This is where a lot of people have the fear, their fear of dialysis and the fear of the unknown will get the best of them. So this is where you want to start really listening to your doctor, following the plan, so that you won't have to go to dialysis. But when the day comes that he tells you you have to go to dialysis, it's best to learn everything you can about it instead of being in dialysis. Being in denial, it's best to get that access place, that fistula place, or that graft place, even though you might never even need it. You might never go to dialysis, but at least it's there when you're ready. So talking about it, talking about what's next is very important. Kaimi, did you have a question?
Yes, there is a question in the chat. It says, will there be a clinic in Nanakuli?
Oh, there is a clinic in Nanakuli right now. Yeah, there is a clinic. So before there was only, when it comes to dialysis clinics, people had to travel. You had to travel to dialysis to get your treatment, because it was kind of like going to the hospital or going, into town for your doctor's appointment. But now it's different. Dialysis is starting to branch out. In Hawaii, we have 2 companies that provide dialysis, and yeah, that's where we're headed. We're headed to a place where I would hope that dialysis is more normalized, and it's available to every community, that you don't have to drive into town. And being way out here in Waianae, we now have 2 clinics in Waianae, and going down the road to the mall 5 minutes away is a lot better than having to drive even to Kapolei or even to Nanakuli. So there is a clinic in Nanakuli, and there will be a lot more clinics, even in the outer islands.
Leialiʻi, we have a couple more questions.
Okay.
Does it look as comfortable as Waianae's clinic?
Nanakuli? Well, Nanakuli is a brand new clinic. I'm pretty sure I work for a different company, but I have worked for both companies. And what I can say is that we both try to provide the best care that we can for our patients. All clinics, including my clinic, well, most clinics. If you wanted to have a tour or take a look inside, I would suggest that you can call the clinic and ask them. But most definitely, if you wanted to come out to Waianae to take a look at our clinic, please do.
And then our last question, can you maintain stability in stage 2 to prevent progressing to stage 3?
Definitely. You can. There's a definite chance that you can. My Hanai mama is teetering on stage 2 and 3 right now. And for the most part, once your kidneys are damaged, you know, it's difficult for you to regain function, but it'll teeter between like that GFR like of 10, like that score of 10. So at one time when the doctor started saying, oh, mama is having some kidney damage, I said, okay, I want to see the lab. I just want to see the labs because I can tell, oh, her potassium might be high or her GFR might be low, you know, her BUN number is high, creatinine number is high. So those are all waste product numbers. So I look at it, and then her GFR was, I think at the time in the ER, it was down to 29. So I'm like, oh my gosh, you know, what happened? So what did the doctor say? The doctor said to watch protein, drink water, and she gave a plan. So like anything else, if you try your best to follow that plan, there's a pretty good chance that you might be able to hold it off, to stall at stage 3, to stall at stage 2. But if I was in stage 2, what I always recommend is that if the doctor is recommending that you get that access placed, that's something I would definitely recommend, even myself, because what happens is when I was working in acute dialysis, so outpatient dialysis is called chronic outpatient dialysis. People walk in and walk out, or on their wheelchair in and wheelchair out. They're stable. Now, acute dialysis, when I used to work in acute dialysis, I would do it at all the different hospitals on Oahu. And a lot of times I would have patients who, they have no idea. They have no idea they even had kidney disease, you know, and they've been walking around like fine. They had no reason to go to the doctor for anything, but say they had like knee surgery, and then you go in for that, and then they print up your lab results, and it's like, oh my gosh, you need dialysis now. And that's a real thing. I've seen it many times. And I think that's the hardest part too, when people really don't know that they have it. So that's why I think it's very important for us to know our GFR. So GFR really should become a household name, like or a household term, like say hypertension, you know, high blood pressure. Because if we knew it, then we could keep track of it, and we would try to prevent it, right? No, you know, if you knew you were going to go to dialysis, a lot of people would try their best not to. So this is what a dialysis station looks like. You have a reclining chair that might have a heater or massage, and then you have your own TV to watch. Typical treatment schedules are 3 times per week. We do like a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday schedule. And then it's a early shift, midday shift, or a PM shift. So for the most part, we're able to work with your schedule. Here at Waianae, we are very fortunate because we're still building our clinic and filling up our clinic. So all the shifts are available. But like I said, dialysis clinics are popping up everywhere, and hopefully you'd be surprised how many patients are on dialysis, and they should really be in every community. So people can come in and get their treatment and then go on living their lives. You would normally spend between 3 and 5 hours on dialysis, cleaning your blood, and then you can get extra treatments as needed. So sometimes the fluid buildup is so great that we're not able to remove all the fluid in one session, that it would be best if you came in the next day for a few hours. So things to bring would be layered clothing, blanket, and a sheet to cover the chair. And then whatever you need, some people do work, they bring their laptops, some people will bring their headphones and just watch TV. And a light snack is okay too. This is part of my team out here. We have our registered nurse. One nurse will oversee 12 patients. But the 12 patients, every 4 has their own patient care technician. So each technician will put a patient on, place their needles, start the machine, and then monitor. So you have coverage all the time. You have access to a social worker, which will help you with any financial needs, transportation needs, and psychosocial needs. You have a registered dietitian, which will help you with diet. Our biomedical technician is the person that takes care of all of our machines and our water system, because our water purification system is pretty advanced. And then, of course, you have your nephrologist, who's your kidney doctor. Some of them have nurse practitioners that come out to the clinics to round on them because the need is so great. And then you have administration that oversees everything. So I always use this. So I have a picture of a cup of tea because I like to use visuals for my new patients. And so that's pretty much what happens to your body. So you really want a very light tinged tea. But when the toxins start to build up, it gets darker and darker, and then you come to dialysis, and then it cleans it all out, cleans your blood out. Things that you will see if you don't come to dialysis are difficulty breathing, because you have to picture you have 2 kidneys, and then they're cleaning your blood, and then all of your shishi or urine that it makes goes into your bladder. But now the kidneys don't work. So where does all that fluid go? It just stays in your body. So you start to get swelling of the legs, and then you have difficulty breathing because the fluid just builds up. You feel tired because the kidneys aren't telling your body to make blood. So most dialysis, well, pretty much all dialysis patients become anemic. And then you get itchy because that toxin is building up. Things you cannot see are damage to the heart, blood vessels, and your bones. So physical challenges, again, you're tired and drained. Some are so tired and yet they can't sleep. Some feel dehydrated because when we set the machine to remove some of that fluid, we might remove too much. So we try to estimate their dry weight. And that can be challenging for a brand new patient to find their estimated dry weight. A doctor might say, okay, we're gonna try to aim for 60 kilos. And then they come in at 62 kilos and we only took off, a little bit of fluid, and then you start cramping, you have dry mouth. So these are all the things that can definitely happen. Decreased libido because of their, it's a lot of emotional strain as well. And then you have your loss of strength. Psychosocial challenges, definitely depression is number 1. The fear associated, the loss of independence, they have anxiety, not knowing what's going to happen. The feelings of burden, becoming a burden to their family, having stress, and just having to live with these restrictions overall are very, very difficult. That is why we have access for our patients to a social worker to try to help with some of that. I see the best over all my years of working in dialysis, the patients that do the best are the ones that have support. How do you support? You can bring them to dialysis, you can try to help your family member with their diet. But really how you can best support your ohana is to gain knowledge about it, what it is and what it does. Ask them questions about what they learned at dialysis. When they come home with information, read it so that you understand, because when they come home and they're not feeling well, you know what to expect and you know why. When I was younger and my auntie would be sick, or not feeling well, I just thought, oh, it's dialysis that's making her sick. But it could be a combination of things. You also want to give them the space if they need. And normalizing dialysis, you know, making it part of your conversation and your routine, supporting their routine and helping them get out to do other things beyond dialysis. Participating in their care. So, you know, rarely do our patients get very ill all of a sudden, meaning something new that we don't know about, because we have a dietitian, social worker, you have a nurse, they have a whole team of support here to monitor them. Participating in their plan of care meetings. So we meet regularly about our patients and their plan of care, and our patients and family are always invited. Tracking home medications is very helpful, so you know what meds they take and why. And then support groups. So some clinic out here in Waianae, we had a strong desire to have a support group, so I'm getting ready to start something like that out here. So Native Hawaiian healthcare providers in dialysis. So how much time do we have? I'm not sure. Oh, okay, we're getting down to the line. But I went to nursing school. I did not want to go into dialysis, but I was awarded with the Native Hawaiian Healthcare Scholarship, and part of that is that they fund college for you because they want you to be placed into your community to serve other Native Hawaiians. So they placed me, after I graduated, I was placed on Molokai. I love Molokai, I'm still there, but I did not want to work in dialysis because I was afraid of it, but it became my heart. So here it's just a little snippet of a report. You know, there is a critical shortage of nephrologists in Hawaii. So we do need more doctors, and Native Hawaiian doctors is definitely something we need. Here's another snippet. Among 3,800 individuals receiving dialysis or PD in Hawaii, most are receiving their care on Oahu. Of the 968 receiving their care on the outer islands, 383 were identified as Native Hawaiian. So a lot of Native Hawaiians in dialysis. And with that said, we should have more Native Hawaiians providing their health care.
Mahalo, Leialiʻi. We have another question.
Okay, go ahead.
Do you know of programs that help us to prevent getting to this point?
Oh, definitely. Definitely. So Papa Ola Lokahi, I know, I'm not sure if on their, I'm pretty sure you can find some information there because the Native Hawaiian healthcare system is amazing in that we try to do a lot of preventative clinics out there, whether you're in Waimanalo, you know, Kalihipalama, out here in Waianae Coast Comprehensive, they do a lot of health screenings. So, or even just asking your doctor, you know, get your regular physical every year. Participate when you follow like Papa Ola Lokahi, follow this group, Mauli Ola Malama Lama. You can follow Waianae Coast Comprehensive. They usually post when they're having clinics and drives, like diabetes drives. I would participate a lot, and we do blood pressure screening, we do diabetes screening, or again, just simply asking your doctor, hey, you know, what is a GFR? I attended a seminar on dialysis and CKD, you know, what is that? And then you can monitor it. And then if you find that you're in a certain stage of CKD, ask them what I can do. What can I do? I don't want to go to dialysis, so what can I do? And the plan is pretty, it can be individualized, but it's pretty set plan. My mama is 97 and she has been in CKD 3 for, I would say about 4 or 5 years now. So serving our own and the importance of Native Hawaiian in healthcare and dialysis. So I know, and within myself, I mean, I know there's a lot of historical mistrust. You know, our cultural healers or our family, we take the time to learn about each other, like the whole person, not just, you know, your sore foot or, you know, your belly ache, or, you know, we want to learn about the whole person. And Western physicians, I know they're so restricted in time and they only focus on the problem. So that's where a lot of mistrust comes in. And this is where I truly believe that more Native Hawaiians in healthcare are needed, because we understand both sides, and we're able to build that bridge that we need to help our own. Let me see.
We have one more question.
Okay.
It says, I have a Medicare client that stated his dialysis treatment is partially covered and the fee that he is responsible for is in the thousands, which many Medicare kupuna are on a fixed income. Is there any other insurance or financial assistance they can apply for that will help them with these high costs?
Yes, definitely. So one person, and I feel really bad right now because I left her out of our healthcare team, is for either company. So I work for US Renal Care. Our competitor company is Liberty Dialysis for Fresenius, but we are both required to provide all aspects of care with dialysis, because dialysis is a life-sustaining treatment. You need it in order to live. So one part of that is our FSA, or our Financial Services Advisor. So whether you're with our company or a competitor, they should have a FSA available to assist with any insurance needs. When it comes to Medicare, it's actually just about time for Medicare enrollment period. So you want to speak to a broker. First, you want to speak to your FSA, tell them you want to look at insurance options because your copay is too high. We are not allowed, like I am not allowed to tell my patients, you know, oh, go and get this insurance or that insurance. By law, we're not allowed to do that, but we do refer them to a broker that will help them pick the best plan for them. And that's not just for dialysis, that's for everyone. So anybody out there who has Medicare parents or kupuna on Medicare, where you find that the costs are increasing and your needs are changing. So say if you need more home care, you're moving into hospice, or you know, you definitely want to look into the best plan, Medicare plan for you. But please, for the person who asked that question, seek out your social worker first at dialysis and then your FSA, and they should help you with that. Any other questions right now? Okay, so let me just leave you kind of with this. That when you're at CKD stage 3, right, and you have damaged kidneys, you have a chance to make a change and stall and keep it there forever. But when your doctor comes and tells you, hey, you're gonna go to dialysis, which I know a lot of the nephrologists on Oahu are in Hawaii, and they will just tell you right away that that's kind of where you're headed. And then they will tell you when we're just about there. They want to try to prepare you. They don't want you to wake up one day and end up on dialysis. That's the worst case scenario. Or even, you know, die because you didn't know that you had kidney damage. So remember the GFR, ask your doctor about it. If you're on the way in a certain stage of CKD, you know, do what it takes to try to prevent it from happening. But if you know that you're headed towards dialysis, please don't, try not to let denial get the best of you. Because if you start to talk about it, if you start to prepare for it, with work, with family, transportation, finances, the ones who have the patients that do their best are the ones that have a lot of support. And dialysis isn't just prolonging life. It truly is a way to live, to continue to live, to see your mo'opuna, to see your kids graduate. I have people that come and they go to work and they live pretty normal lives. I'm not trying to sugarcoat it because it is very difficult. But you have a whole team at a dialysis center to really help you out. And as far as working in healthcare, I truly encourage anyone, any nurses out there, anyone interested in working in healthcare. Dialysis is a field that can offer so much opportunity. Like for me, I didn't even want to work in dialysis in the beginning. And, you know, I just went into different areas of dialysis. I left dialysis and worked in the ER for a bit, and then I missed it. I missed the people. I missed the service because I knew that the need was great. So if you're interested in working in dialysis, just Google. You can find a lot of different roads to do what I do. And for me, I'm from Nanakuli, and dialysis brought me home. And I'm sure, like Lisa said earlier, the scholarship program, that's truly the goal of the Native Hawaiian Health Scholarship Program, is to put Hawaiians back into their community. So I just wanted to say thank you so much for the opportunity. Does anyone else have any questions?
No, we just have a lot of mana'o, just thanking you for doing this presentation.
It's a very simple presentation, and sorry, initially I think I was very nervous, and not just because it's public speaking, but because I want to get the message out, because I care very deeply about our community, and I care very deeply about people on dialysis. And I really, really want to try to remove some of that negative stigma attached to it. You know, look around you. If you see someone on dialysis, support them and tell them they're doing a great job, you know, and they're living, they're still here. And that means a lot to them. Mahalo.
Mahalo nui, Leialiʻi. That was very, very informative. And you're right. I've actually never seen the inside of a dialysis clinic. So, you know, I think that's a great talking point to ease people, you know, their minds and stuff. So mahalo nui loa for spending the time with us today. And also for those that have joined us online. I know some of you have to leave, so mahalo for joining us, and those that will be receiving the recording. It will be about a week before we have the recording ready to distribute, and also you will all receive the PowerPoints. Very, very informative PowerPoint slides that Leialiʻi put together all the numbers and definitions. So we're really, really thankful for that. And so just to let folks know, our upcoming webinar will be on November 12th. Next month is Native American Heritage Month. So we have invited the Oahu Intertribal Council, some of the members, to come and talk about their work in Hawaii. So I don't know if folks know that there's even a Native American Council here. So I'm waiting to hear back on them, and you'll also be receiving that announcement for that webinar. So again, I just want to thank Kaimi and Kamawela, my kāko'o, for helping me with this webinar. And we'll keep in touch. So malama pono, malama kikahi ahuiho. And we'll keep in touch. And then
if anyone has any other questions, you can just forward it to me. I see some of the questions.